Okay, so for everyone who's just hopping on, we're going to go over digital lobby visits, advocating for Medicare for all during COVID. And yeah, obviously, everything we're going to talk about has been changed a lot because of COVID, and we'll definitely spend some time talking about that. But the first thing I want to do, I think it's important to give everyone a sense of the big picture. So in all of our campaigns, this is kind of these are all the tools we have in the advocacy toolbook. It's called Escalation of Activism, and it's escalating on this chart in terms of how much it asks of you, of the activist. So as you can imagine, at the bottom, the first level, sending an email, writing a letter, or calling your office is kind of like the lowest threshold. If you're an organizer in your community, it's kind of the easiest thing to get someone to do. I might put like signing a petition in here also. I guess I should add that to the slide. A little higher than that is, actually meeting your representative face-to-face, which is what we're going to talk about today. It was especially higher earlier on, pre-COVID, because you had to actually go in person. Now it's a little easier because you can do it on Zoom, but we'll talk about that a little later. And after that, you get to bird dogging. Let me let these folks in. So bird dogging, I don't know if everyone here is familiar with it, but that's more about going to a town hall to speak directly to your representative, raising your hand, asking a question, and the kind of more ambitious creative forms of bird dogging can be meeting someone in an airport or outside their office or outside a restaurant or kind of wherever they are. You may have seen some of those viral videos around the Kavanaugh protests and other protests that CPD and other organizations have done. And then above that, you get to protesting against civil disobedience. I think many people are familiar with this, especially after this last summer. It often involves, it often ends in arrests. It often, is a sit-in or, blocking a road or, some sort of something that's often obstructing. And there are different kind of ways that, different things you can accomplish with that. Before I move on, CPD does an entire bird dogging training and an entire civil disobedience training. So if people are more interested in learning, why those tools are useful, we can dive into that. Another reason I wanted to kind of show this is because obviously different people are comfortable doing different things. Some people are very comfortable, engaging in civil disobedience and getting arrested, but for some very valid reasons, people are not and might just want to send letters or emails. Other people might want to do lobby visits. And also because, this is healthcare organizing, lots of the people we're organizing have disabilities and, going to DC might not be accessible, jumping on a Zoom call might not be accessible. So having different options for people is incredibly important. So before we dive into lobby visits, I just want to give, I think, 2 examples of how this whole kind of map can come into play. So one, I think the most notable example that I've been involved in and CPD has been involved in the last couple of years was our efforts to protect the ACA. In 2017, Republicans first tried to repeal the ACA. And so we used all these tools in the toolbook, right? So like, what does that look like? Well, we had all kinds of people at home, sending emails and letters to every Senate office, asking them to protect the ACA. We had people who, could go to DC meeting in person with those senators. We also had meetings like in district back at home with their district offices. We had people flooding town halls talking about healthcare, saying like, hey, if you get rid of the ACA, I can't survive, my family can't survive. And then we engaged in civil disobedience. I was in DC, I got arrested a couple of times, telling my healthcare story, which is a mental health care story, which I'm gonna tell a little later. And we did sit-ins over and over again. And eventually we got Senators McCain, Collins, and Murkowski to protect the ACA. If you remember, John McCain did it rather dramatically at the end. So yeah, that's like kind of one example of how this all works. And another healthcare example is the CARE Act. If people are not familiar with the CARE Act, if anyone here is interested in doing overdose work, combating the overdose epidemic, the CARE Act is really the best, most ambitious plan to combat overdose. And so at the beginning of the Democratic primaries, which seems like a very long time ago, we went to Iowa to have a bird dogging expedition. And I mean, if you remember that season, like every day, each candidate would have like 2 or 3 events, right? So we would drive around Iowa and make sure every time a candidate spoke, they would get a question about the CARE Act. And while people were in Iowa doing that, I was in DC doing lobby visits, meeting with representatives in person, their staffers in person, We had people doing petitions and emails about it, and we did 2 or 3 civil disobedience protests on it also. And at the beginning of the campaign season, none of the Democratic candidates even seemed to really know what the CARE Act was, other than Senator Warren, because it's her bill. But at the end of the season, every single one of them had become co-sponsors, and likely will again this new year. And our new vice president was one of the co-sponsors, so that's also significant. So those are just 2 kind of big picture examples on how this ladder works. I think it's a really helpful way. People often ask me like, hey, is it like really worth it going to a protest? Is it really worth it, talking to my representative? Like, how much difference could that one engagement make? And yeah, one like single engagement might not, change the world, but like you're playing a part in a much larger movement, right? Like you're one role on a team. And like if we're all collaborating and doing it very strategically, like it absolutely does, affect change. It absolutely does, change how representatives vote on these bills and serve their constituents, which is what we want. And that's how we're going to win Medicare for all. So now let's talk a bit about this part, lobby visits, meetings. What does that mean? What does it look like? And I'm not looking at the chat right now, but if questions pop up, feel free to drop them in there, because I'm going to look at them a little later. So the first thing you need to do, obviously, is reach out to the office, and you're introducing what we're talking about. So you send an email or a call saying, you want to talk about healthcare in America, specifically Medicare for all. And if you're working with us, we can help you figure out who the best person to reach out to. There's always usually a scheduler who can set up, a Zoom meeting, but they're not always easy to find. So you can talk to us. I can send some resources that are helpful after the conference is over. And then, you do the actual bird dogging or lobbying. And again, there's a separate bird dog training if you want to learn more about that. And then I think the most important part is you actually follow up after, because, just one of these lobby visits, one conversation with your representative is useful, but you need to have more. You need to follow up, especially if they promise you something in a meeting, you're going to want to follow up. If they say they're going to send you something, follow up. This is like the start of a conversation. It's not the end of one. So just keep that in mind. But what do you actually need to kind of pull this off? You actually don't need much. Everything you need, you already have before you even started this presentation. And I'll definitely emphasize that later. But for the meeting itself, like you need a goal, which we're passing Medicare for all. I think we're all on board with that. You need a team, which is kind of the crew you're going to pull together, which is made up of constituents, which is, likely the people on this call or the people you're organizing. A policy person, if you're working with me, I can be that CPD staffer, or one of my colleagues could be. If you're an organizer yourself, you would probably play that role. Knowledge of your policy, you want to know about healthcare in America, and we're going to break down some of the important talking points in this presentation, and kind of just knowing, where your representative stands, what they've done in the past. Are they a sponsor already? Are they a champion? Are they a leader of this movement? Are they like a complete antagonist? So keep that in mind. I think an easier way to look at it, rather than just, these kind of words, is like a little chart. Oh wait, that's the next slide, sorry. So the kind of 3 or 4 basic steps of the meeting itself before we get to the chart is, so you walk into the room, like back in the day, pre-COVID, if we can remember those days, walking into an actual physical office. But it could also work just like walking into the Zoom meeting. And so usually I would start, if I'm running this meeting, as the staffer, saying like, I'm representing the Center for Popular Democracy, and we're here to talk about Medicare for all. And I brought in some of your constituents to tell you some stories. And like, that's really the most important part. My role kind of recedes after that, because this part right here, constituents sharing their stories, is the bulk of the meeting. So I might talk for like 2 or 3 minutes at the start, and then we might go for like 10 to 15 minutes of constituents sharing their stories. So that's why it's great that you're all on this call, and we can like help you feel comfortable doing that, because you're really driving the meeting. Especially if I'm meeting with all these senators, I'm not their constituent and you are. So like, you're the leader of all this stuff. And then make sure at the end, after you tell your story, after you talk about what the issue is, you make a very specific ask. One mistake people make is it's not a specific ask. Like if you tell your healthcare story and then say, what are you gonna do about it? That's not a good question, because every candidate, every senator has, their go-to talking points. and they'll kind of just rattle off, well, this is what I'm going to do about it. This is what we've already done on it. And it's really not what we want, right? We want a very specific question. Will you support Medicare for all? Will you commit right now to supporting Medicare for all? Because that's what we want. And we want to put them on the spot so they can commit yes or no, or maybe. And so we can follow up with all of that information. And I believe the chart is right here. Yeah. So kind of structure of these meetings, I just went over it, but like a kind of easier way to look at it is, you walk in, you present the problem. Why are we here today? So the problem is American healthcare system does not work. And I'm going to show a couple slides later on why that is. But judging by the fact that you're all at this conference, I think you're well aware of that already. I put this part in green because, as I said, this is really the heart of the meeting, sharing your story. And you're really humanizing these issues, making it relevant. And then after you share your story, you're going to want to connect it to the broader community. Like, this is not just some anecdote or some, strange situation. This is like systemic. This is like how the system affects people. It's affecting hundreds, thousands of people in the exact same way. And that might often take the form of someone leaving like a one-pager, like a fact sheet, some sort of literature, something they could read, or a collection of stories or letters. And the staffer can usually help you with that. And then finally, as I said, making your ask, will you commit to supporting Medicare for all? So this is kind of helpful just to keep in mind. And later, I'll show you an example of like all 4 of these steps, and you can practice it yourself at the end. So again, keep that in mind if you might want to volunteer later. But let's just go through each of these 4 first before we practice. So the problem, I think we know about that, but it's worth just reminding everyone. There's so many different problems with the American healthcare system. I put just a couple of bullets up that I think often produce very compelling stories in lobby visits. So obviously, the number one thing that often comes up for people is the rate of uninsured people in the United States has risen to nearly 30 million. That was pre-COVID. During COVID, another 6, 7, 8 have been added to that list. And an estimated 44 million are underinsured. And that's something that not as many people talk about. Certainly in the media, you don't actually hear that number as much. But even people who have insurance, they could be underinsured, which means their deductibles, their copays are basically prohibitive, right? Like, they really don't feel comfortable using their insurance because it's just not affordable. So technically they're covered if something, truly horrible were to happen, but for all practical purposes, they're not really making use of this. They don't feel comfortable, with their insurance. And it's really not protecting them or giving them the care they need. So if you put those numbers together, that is a heck of a lot of people. It's rising as COVID, gets worse and worse. And there are consequences to that, right? If you talk about the inability to pay medical bills, often leads to personal bankruptcy. Of the people whose illnesses led to bankruptcy, 76% did have insurance at the onset of their illness. So again, even if you do have insurance in America, you're still not protected because the system will prey on you. It will bankrupt you. And I think we all agree here that if you're sick, you should be able to see a doctor, ideally for free, and it certainly shouldn't have to, put you in debt or take hold of your life. And again, another story that often comes up is 1/3 of US adults say that in the past year, they have to choose between paying for food, heating, housing, or healthcare. And as you can imagine, during COVID, this has really become a big issue because COVID is a housing crisis, right? So many people are being evicted. So many people can't pay rent right now. And well, I guess there's an eviction moratorium, but you know what I mean. And I used to work at Housing Works, and we would always say that housing is healthcare, and you really can't manage a chronic illness if you don't have a place to live. I mean, you can, but it's incredibly difficult. So because of the housing crisis, because people are losing employment, this is all getting much worse, and many of those people are just foregoing healthcare in the middle of a pandemic. And this country should really never be in a position where this is happening. So these are all talking points that, if any of these stories are relevant to you, if you kind of fit into any of these categories, these are the kind of things that will definitely move lawmakers. This one's repeated again, but I added 2 more here. Racial inequities, right? Look at the populations that are being affected by COVID. We know who they are, right? They're Black communities, they're brown communities, they're people with disabilities, people who this country deems to be expendable for one reason or another. And even pre-COVID, it was those same populations that were falling through the cracks of our healthcare system. Of those uninsured, 59% are people of color. I'll drop a link in the chat later. Some of you may have heard of Dr. Manhattan, Dr. Sanjeev Sriram. He does a really great all means all presentation and campaign talking about racial inequities in healthcare, and that's worth checking out. I know he actually spoke at this conference. I'm not sure which day, but maybe you attended. And then I myself often do lots of mental health advocacy. The COVID crisis is a mental health crisis, and even before COVID, so many people just did not have access to mental health care. There are structural barriers, there are stigma, and passing something like Medicare for All would, normalize mental health care in ways that would completely transform the way people talk about mental health care, the way people access it. So if you have a story that fits into that, that would also be very compelling. And these are just a couple examples I hear a lot, but unfortunately there are endless examples. So after we talk about the problem, if you remember, that was like the little first bucket. The second bucket was people impacted telling their stories, and we're going to spend some time talking about that. And then a staffer or you could leave behind like a literature one pager saying like, hey, these stories are happening all across, your district or your state. This is happening everywhere. And then the final thing we do at the end of the meeting is our ask, will you support the Medicare for All Act? And, if they say yes, if they're a co-sponsor, you can go further and say, well, will you be a champion? Will you help get some of your colleagues on it? Or you can ask like, how can we help you build support for it? And yeah, depending on where they are, you always want to document that and follow up and report back to your organizer, and we'll use that information to craft our strategy. So that's kind of the basic setup. So, let me just go back a second to review. So yeah, so you present the problem, people tell your story, you connect it to the broader audience, and then you make your ask. And that may sound like a lot, but it's actually pretty simple, and we're going to practice it. But before we practice, just remember that you're not done after the meeting, right? You get a yes or a no, or maybe what do you do after you follow up? We'd like you to follow up at least 3 times. You can, so you can follow up with an email or a call. When it was in person, we would always like to, we'd ask the staffer, can we take a picture with you? So if there's like 4 or 5 of us, we'd stand outside the office with the staffer next to the little senator's placard on the walls. I don't know if any of you have been to DC. It's often the same in district state houses also. But we take a picture, then we tweet it out and say like, hey, we just met with Senator so-and-so. We talked about Medicare for All. The senator committed to doing X, Y, Z. Looking forward to talking to you again, and just, put them on the record, make sure it's known. And then also follow up with emails. Just keep at it. And if you keep doing this in different contexts, emails, selfies, tweets, eventually you get what you want. So I mentioned earlier in Iowa, we were trying to get people on the CARE Act. And so this is just one example. Senator Booker joined, but also every other Democratic candidate who ran for office joined too. And that's how we win, right? Our whole theory of winning at CPD is you bring people directly impacted, the constituents, to their representatives with very specific demands over and over again in different contexts. And that's how you make change. My boss often likes to say that to make change, you need either lots and lots of money or lots and lots of people. And when it comes to healthcare, our opponents have lots and lots of money, obviously, right? But we have the people, right? Like there are so many more of us than there are of them. And if we, mobilize and organize and kind of wield our stories, like we can totally end up winning. So before we practice, I wanted to walk through some common like opposition points you'll get, like if you're doing Medicare for All advocacy, whether that's in a lobby visit, whether it's just like talking to your friends or like making a post online. If you're going to talk about these things, you're going to hear this pushback. I think you all know what I'm about to say. The number one myth is we can't pay for it. How are we going to pay for it? It's impossible. And that's just a complete lie. I imagine many of you know this, but it's worth repeating that that's not true. Like, it not only can we pay for it, it's cost saving, right? Medicare for All will actually save money. The two leading studies on the subject, one from University of Massachusetts Amherst, found that we'd save $5.1 trillion, and another found that we'd save $2 trillion, both over 10 years. A third study came out recently. I did not add that yet to the slide, but it's similar findings. And if you want to talk through where would those savings come from, the number one source of savings is reducing administrative costs. There are just so many administrative costs right now in our system because there are just so many different payers and so many different systems, and that would all be consolidated and streamlined, and we'd save about $1 trillion a year, possibly more actually. And also because we'd all be under one system, the government could negotiate to lower drug prices in ways they can't do right now because they're not representing all of us. Sorry. So yeah, people will tell you all the time, this is a right-wing talking point. This is propaganda. The idea that we can't pay for Medicare for all is just nonsense. It would save us money. And also it's a bad faith argument, right? Because we already are paying more than anyone else in the world, pretty much. And, by a significant degree. So the idea that, oh, like it's suddenly now too much money just doesn't make any sense, because like we're already paying way too much money for our healthcare. And what has it gotten us, right? Like we're at the bottom of most healthcare indicators in terms of what makes for a good, healthcare system. And yeah, pretty much every similarly constructed country in the world is doing a much, much better job than us at this. And so another myth before we get to that. So yeah, so it's a bad faith question, right? How will you pay for it is basically, propaganda. The real question is, what are we going to do? How do we best invest the savings this will bring? How can we use that extra money to improve our system? But related to that is this idea that it's impossible and it can't be done. And I always feel like that's either like a lack of will or a lack of imagination, or it's just people acting in bad faith, because clearly it can be done. So many people have done it. So many countries have done it. The green are people who have done it, and the red, as you can see, we're in the minority here. We're clearly falling behind the rest of the world, and people are dying. People are dying because of it, especially during COVID. So it's good to keep that stuff in mind, because you will hear that in meetings. And then some COVID notes. So obviously a lot of this has changed with COVID. You're all on Zoom now, so that tells me you have Zoom access, but not everybody does, right? And some senators will have, some offices will have their own platform. So if you are like organizing one of these meetings or attending one of these meetings, just doing a basic tech prep, make sure you can actually, have the capability to do it is important. One good thing about this era is some people have more access to these meetings than they did before. Obviously, we're organizing lots of people with disabilities, and some of them, it's just not accessible to get on a plane and go to DC, or maybe not affordable to go to DC or to an office, but they could just hop on a call from their home, and that's great. But other people have other accessibility restrictions, and hopping on a call doesn't make sense for them, especially since Zoom in many cases doesn't have like closed captioning, or doesn't have a great way of doing closed captioning. So it may be inaccessible to other people. So if you're doing this work, you should keep in mind who you're inviting, how they can contribute. And if this kind of stuff is not accessible, think through that ladder I showed at the beginning, other ways you can plug people in. In terms of following up, we could always leave a business card if we were in person, but again, you can do that through email these days. Please keep yourself muted when not talking, just kind of basic Zoom etiquette. And yeah, dress appropriately, but for Zoom, that's not too hard. Shouldn't be too hard, at least from the waist up. You should be fine. So yeah, just keep those in mind. I think there's one more note. Yes, there is. So I'm sure since you're at this conference, you've all attended a bunch of talks and workshops. I know there's, I think, a couple of more today. So I know you're going to forget a lot of what you learned. That's what always happens at conferences, right? But if you forget everything I say, like remember this one point. People will often tell me like they don't feel comfortable like meeting with their senator or their representative, because they're like, well, I'm not a lawyer. I don't like know the text of the bill. I'm not like an expert on this stuff. So why should I be there with you? And that's not how this works. That's the opposite of how this works. Like you're all an expert on your own story, especially if you've been directly impacted by our healthcare system. You know your story better than I ever could. I can never learn it more than you already know it. So like, that's all you need. Like, if you can tell your story powerfully, that's all you need to carry out these meetings. And we're going to practice doing that in a couple of minutes. So if you ever feel hesitant, I hope you remember that and feel emboldened. If you're ever organizing someone or have other friends or activists who have a similar kind of hesitancy, and I pretty much guarantee this is going to come up at some point, just remind them, like, hey, if you know your story, like, that's all you need. You're a constituent talking to your representative about the healthcare system, how it's affecting you. So just like tell them how it's affecting you, and that's it. That's really all you need to do. So to give an example of what that looks like, I don't know if any of you are familiar with Rebecca Wood. I think this talk is from a Healthcare Now conference, and it's just going to be like 4 minutes of her telling her story, and it will be moving. Unfortunately, these moving stories are often sad in many ways, but we can turn that pain into action, which Rebecca actually says herself. So I'm just going to play this for you. I think I need to jump ahead a bit though. And this is a good example of the kind of effect you can have by telling your story. Someone shout at me.
An interest in politics. My daughter Charlie was born 10 hours into her 26th week of gestation. She weighed 1 pound, 12 ounces, and was the size of my hand. I joined the healthcare fight because her birth is a pre-existing condition, and even with private insurance, she relies on a Medicaid waiver for much of her care. Charlie celebrated her 6th birthday last month. When the big day arrived, I thought about that tiny 1 pound baby in the NICU. Her underdeveloped lungs fought for each breath. She winced and recoiled every time her thin skin was touched. I feared we were asking too much of her, yet Charlie fought to survive. Mostly, I remember the shock of how my seemingly normal pregnancy turned our lives upside down within a matter of days. Unbeknownst to me, this is when my fight for healthcare actually began. Her birth taught me that there is no such thing as good insurance. In my scramble to fulfill her healthcare needs, I disputed automatic denials, sought out affordable services, and fought to receive the benefits included in our insurance coverage. Despite the obstacles, we were lucky. I was able to find services for her. OT gave her the use of her hands. She wants to be a doctor and a drummer. PT made it possible for her to run and jump. Speech therapy is why she can talk and say, "Mommy, I love you," the sweetest words to my ears. Her developmental progress far exceeded her doctor's initial expectations. However, all of it came at a cost. I had to make impossible choices. Should I pay for her therapy or my overpriced asthma medication? Choices like these really aren't impossible. I choose to pay for hers and go without mine. One day, I needed an expensive dental procedure. Unfortunately, it was at the same time a therapy payment was due. Charlie's speech was emerging. I was afraid we would miss a window of opportunity in her development if we cut therapy. I chose to pay her therapy payment and put off my dental procedure. The decision cost me dearly. Due to the delay, an infection spread throughout my mouth and jaw. I went to the emergency department because the swelling in my mouth obstructed my airway. After a course of IV antibiotics, I was discharged. The next day, I had all of my teeth pulled, the infection drained, and parts of my jaw scraped away in a 6-hour procedure under local anesthesia. I could not afford to have it done under general anesthesia. I cried the entire ride home afterwards. I don't know what the worst part is. The excruciating pain, how I worry whether I'm drooling when I smile, how eating is awkward and challenging, or how I love jazz and I'll never play the trumpet again. In addition to the things that we can't get back, like time, opportunity, and quality of life, my family was financially devastated by the healthcare system. These losses are why I started to work towards Medicare for all. I'm lucky she survived. I'm fortunate she thrived. However, it shouldn't have cost me nearly everything. Her name is Charlie. She is why I decided to fight. But my battle for Medicare for all is for me. I have to believe all of this happened for a reason. Thank you.
All right, that's Rebecca and Charlie's story. So that's a powerful example. Rebecca actually testified before Congress advocating for Medicare for all, and she's told that story or versions of it, in all kinds of settings. And actually, sorry, let me adjust my mic. Imagine that was hard to hear. So yeah, I was saying Rebecca has told that story, versions of it. She actually testified before Congress in support of Medicare for all. And yeah, it's kind of an example of, telling that story can totally move a room, it can totally move a representative. And if you're telling dozens and hundreds of those stories, it really completely makes a transformative impact. So just to kind of review the structure of the lobby visits that we talked about, and then I'll give an example myself. So you walk in, present the problem, which is our healthcare system. You tell your story just like Rebecca did. You make it clear that this is affecting lots of people, and then you say, hey, are you going to support Medicare for all? So I want to offer the floor to people who might want to practice that and tell your own story. But obviously, it's a lot to ask because these are personal, vulnerable stories. So I thought I would go first to make, kind of break the ice. So if I were to do this, I would say I do lots of mental health advocacy. So I would say COVID crisis is a mental health crisis. People aren't receiving the supports they need to survive. And, we're here to talk to you today, Senator, about what you can do about it. And me, personally, I live with several pretty severe mental illnesses, which have all grown more severe in COVID. And I'm cut off from so many of the supports I typically use because they're just not really safe anymore. I do have insurance. Luckily, I'm privileged to have insurance, which covers my medication and my therapy. And without that, I really wouldn't be able to afford that care. And, in the middle of this COVID crisis, I'm not exactly sure how I could survive, without that health insurance. So if I were to lose my job tomorrow or next week, I really don't know what I would do. And I'm lucky to be on this side of it right now. But, there are 7+ million people who have lost their health insurance during COVID. Unemployment continues to soar. So how are those people, managing their mental health? How are those people managing their chronic illnesses? With respect to mental health care, suicide rates are increasing. Mental health care emergency room visits are increasing. So because employment is connected to health insurance in this country, so many people are suffering. So I really want to ask you, Senator, are you going to support Medicare for all? Can you commit to everyone in this room right now that you will be a co-sponsor and champion this bill so no one has to be left behind by our system ever again? So that would be kind of my example. So now I'm going to stop the screen share for a second. I'm going to come back. And I was thinking I was going to ask for volunteers, but I want to give you some time to actually think this through a bit. So it's 1:36. Maybe we'll take like 5-6 minutes. We'll just maybe keep it to 5 minutes. If anybody wants to jot down some notes about, what would your story be? What aspect of the healthcare system would you focus on? Obviously, you don't have to cover all of it. Just what's relevant to you. Tell your story. And then we'll get 2 or 3 volunteers to maybe tell their story. I see Anne's raising her hand. Anne, does that mean you want to volunteer?
Just a quick strategy question. I've done a few in-person visits in the past, and the structure sounds really familiar and great. Does each person make the ask at the end of their story, or do you do all the stories first and then the group makes the ask?
I think either way works. I mean, it's clearly we're all here for the same reason. It doesn't hurt to reiterate that you want support for Medicare for all.
Okay.
Yeah, Sarah, did you have a question?
Yeah, hi. Thank you for this. First of all, it was amazing. I just wanted to ask a quick sort of follow-up on the question, the sort of common opposition you will hear of we can't do it because look at other countries. And actually yesterday I had the opportunity to be a part of another amazing workshop with excuse me, Partners for Dignity and Rights, and they kind of brought up with that issue, sometimes it can be perceived almost as like a white elitist talking point, and that like there's an assumption that you can travel and see how other countries are doing it. So I wonder if you've run into that, and if you have people that have tried to push the narrative more of just like healthcare being a basic human right, like not even looking to other countries, but being like, if America is a democracy and we're upholding these values, this is how it coincides with that. I was just curious if you've run into that.
Yeah, no, I certainly wasn't suggesting anyone travel to go see the other systems. I was just saying, like, as an example, like, smart people have figured this out everywhere, so we should be able to figure it out. But like, the reason we should be able to figure it out is because what you said, right? Because it's not just like a policy preference, this is like a moral issue, it's a human rights issue. So yeah, that's incredibly important. That usually comes through when people are telling their stories. Like, you know, people will tell a story, like Rebecca's story. A follow-up would be like, you know, how can we possibly let this happen in this country? Like, no one should ever have to go through this. And really kind of strengthening that side of it. Yeah. And we do like I've done like a separate kind of like disability justice Medicare for All presentation, which talks about how Medicare for All is kind of the only legislation that really embodies the values of disability justice, which is very much rooted in that sense of like, this is the right thing to do. This is what we have to do. I don't know if that was helpful. I see some hands raised. Did you all want to volunteer later, or did you want to ask questions before? Just volunteer.
Okay, I have a question. This is Randy Hicks from Sacramento Valley and
Sure.
Healthy California Now, which
Hey,
is
Randy.
great. Okay, so here's my question. I can't tell you how many times when we go into this meeting, we have staffers who don't know what the hell we're talking about. Doris Matsui, when we had our visit with Doris Matsui with the DSA, first of all, they didn't know who we were, so that takes time too. And we have to re-educate them on everything. We don't get a chance to tell the story because they don't know what the hell we're talking about. So we got to re-educate it. And by the time the visit's over, we're stuck with, well, we told you the concept. Do you support this? Because, and the other thing is, we've been told that the numbers are phony. We've been told that. We've been told that this can never work in the United States because we're a for-profit system. It's not enough to tell you a story, because they, you know, you could tell your story all you want. They get it. They probably heard hundreds of stories, but there's a lot of things you have to do to push the needle here to get them to say, you know what, this is actually good for America. And I want to know how you get around that, because we've been through all of this already.
Thank you, Randy. Yeah, I mean, ideally you can get a meeting like with a healthcare staffer, but I know that's often not how this plays out. Often it's someone like a lower level staffer who's kind of just plugged into everything and often doesn't know the specific policies or issues. Part of that is, you know, putting public pressure, making Medicare for All a huge talking point nationally, which I think we've done a good job of over the last 40 years. If you think of how far we've come, like 4 years ago, if you walked into a meeting with Medicare for All, you'd be laughed out of the meeting, like they wouldn't even listen to you. And 4 years later, like that's no longer true. So this is going to take time. Like this is not going to happen overnight. But telling these stories does make a difference, and combating that with a kind of policy advocacy that, you know, policy people and lawyers are doing in different settings, and organizations like Healthcare Now and the other organizations here are doing, are incredibly important. But yeah, we've moved the needle quite a bit over the last couple of years, and thank you, Catherine, for pointing out that I didn't just mean 4 years, but yeah, this has been happening a lot recently. So yeah, the purpose of kind of this call is focusing on those stories and those individual meetings. But I can follow up with some resources about, you know, who are the best staffers to target, so you can have like a productive meeting and not just waste your time, because I don't want anybody to waste their time. So I was going to take a break for people to write down their stories, but did anyone want to ask more questions first? Questions are good too.
Yeah, I'd just like to add that an important tool you can use that's quick is the Congressional Budget Office issued a study last month under Trump documenting how Medicare for All would save so much money. You can just say the Trump administration analysis showed that this will save tons of money. That's a quick way to just sort of, put that in front of their faces. Another strategy we have employed is to pass resolutions in every town of the state supporting Medicare for all without those words. And, I live in a red district, and we're employing this quite successfully because, our councilman doesn't want to be publicly in favor of socialized medicine. But if every single town in his district passes a resolution, then, he doesn't have a big argument.
Yep, thank you, Claire. There's lots of state and local work passing resolutions, which really works as a springboard to this national work. There's lots of great organizations working on that. Yeah, thank you, Claire. Bill, did you want to chime in?
Do you have a particular tip if you're talking to a Republican?
Sorry, what was that, Claire?
I don't know. Do you have tips, in terms of how you talk to somebody if they're against it versus whether you're likely to be persuaded?
I think those cost-saving arguments are going to be big for the Republicans because, as I said, that's usually the number one thing they say is we're not paying for this. Like, this is absurd. And even like behind closed doors, if they won't, agree to it, like publicly shaming them, that's where bird dogging comes into play a lot. It's more like a public conversation that's recorded. And then also now we have the Senate, and we're talking through like ways to get some of this through budget reconciliation, which would be a filibuster-proof way of expanding healthcare, which could kind of pave the way for a future Medicare for All Act. Yeah, I think Bill was going to say something.
I was just going to say we've been lobbying our senators in Illinois and not getting anywhere. And so we took a little more aggressive approach and looked to see how much money they were taking from the health industry complex. And we challenge them and say, will you pledge to stop taking this money? Because how can you reform the system if you're taking that much money? And that gets their attention. I haven't said they haven't changed their mind, but if you want to get their attention, find out what they're taking from the healthcare industry.
Yeah, that's another great way to do it. Like, as I mentioned, like on that ladder, like there's so many different points of intervention. Like the lobby visit is just one tool, right? It's not the whole picture. Yeah, did anybody else have any questions? Or maybe we'll just take 2 or 3 minutes if people want to jot down some notes. Margaret, did you want to go?
Hi, a question came up in a meeting that I was in recently, and one of the participants thought that if you're approaching a male congressperson or other elected official, they're not going to be as moved by stories. They're not going to be moved much at all by stories, whereas a female congressperson or elected official would be more moved by stories. Do you think there's anything to that?
I'm not sure we've based our strategy, on the gender expression of the people we're talking to. I can't, that certainly might be true for certain individuals, but it's certainly hard to generalize. I wouldn't, want to fall.
Have you had any particular experience that would make you think something or the other about it?
Not that nothing stands out in particular, to be honest with you. I feel like we are still, I think our approach has been the same. So it's 1:46, maybe, unless people are ready right now to tell their story, maybe they've already prepped it while we were talking. Did anybody want to maybe volunteer to talk through how they would pitch Medicare for All? I do see some hand raised. Is that why your hand is raised, Mike?
Yeah, I think some people had theirs before me, but I don't mind going. Just quickly, my personal story starts in 2012 when I was fully employed and received my first melanoma tumor cancer diagnosis. And obviously, you assume that under having privatized insurance, that things will be covered and okay. You don't think about making the decisions to save your life because of money. And so I went into that treatment and came out on the other side of $10,000+ worth of debt, medical debt, which only was resolved through careful financial planning, which, if anyone has ever gone through any type of cancer treatment, is the last thing that you want to do during that period. Flash forward 6 more years, and although the treatment in 2012 went well, 2 more tumors were identified. And at this time, though, I was willfully unemployed. I made a choice to leave my job for personal reasons and accepted the risks healthcare wise, but was able to, only through the luck and kindness of medical professionals who kind of coached me through being able to have coverage through my state's expanded Medicaid, did not have to think and worry about the even pricier treatment that I was going to receive. So as anyone who's gone through any type of healthcare crisis, the last thing that you want to have to be doing is thinking about money. Nobody wants to think about money anyway, but added on to the fact that you're stressing mentally, you're confronting your own mortality, friends, family, everyone is having the conversations that you don't want to have. We see small examples where expanded coverage in a state like a Medicaid program obviously benefits myself as a patient more, made my life a lot less stressful in the middle of everything. And we need to be able to expand that nationally, and everyone should not have to worry and feel that additional burden, stress, the mental health toll that it takes while you're going through treatment, but then throwing on finances is not something you want to deal with. So I think that it's absolutely evident that, regardless of how we move to pay for it and should be doing it through savings, we need to have Medicare for all. So I think that's generally how I would go about it.
Thank you, Mike. I think that was great. Thank you for being willing to share that.
Thanks.
And yeah, Mike started with, very personal story, then kind of expanded it saying, this is affecting lots of people. And if you were to expand healthcare up to Medicare for all, it would make a huge difference. I also love that you pointed out just the kind of other kind of factors that like mental health that plug into any sort of diagnosis. It doesn't have to be like, this is a physical health story, this is a mental health story. Like we know that's not how it works, right? It's all kind of overlapping. So yeah, thank you for touching on a lot of those issues. I think that was a really good example. I saw a couple other hand raised. Amber, was your hand raised before? I don't think yeah, it is, I think.
Yeah, I wanted to talk just a little bit about, I've done some lobbying in DC with 50 meetings, a group of volunteers, trying to organize that in one day. We were actually going to talk about the DARK Act and glyphosate. And so we ended up with all these different meetings, and we ended up with 20-year-old staffers in 90% of them. And, we had all of came in with binders of health studies, data, facts, and they just glossed over until we started talking about miscarriages and health stories. And because of that situation, it really is the personal story. But we also came in, we knew, when I went to Delaware, I knew I had to talk about Dow Chemical. I mean, two of the interns that we met with were straight from a scholarship from Dow Chemical to the senator's office. So you have to know the industries that are influencing each person's area before you go talk to them. But that was I just wanted to bring up that example of like a large scale push to have a lot of meetings. But you really just had to be able to adapt and get personal when it meant to get personal, and then be able to, oh yeah, follow up. I'll send you all these studies. I'll send you all these facts. That's really important. I have a horrible healthcare story, but it's too early in the morning to start crying. So I'm going to pass on that.
Of course. Yeah. Thank you for that story. It is frustrating when it's just those young staffers and like they're not the power movers, but usually like I can certainly say it for like every candidate, like who's running for office, I always have one staffer who's in charge of keeping track of how many times an issue comes up. So like if they're in a town hall and Medicare for all comes up like 6 times, they're going to be like, okay, we need a better answer for this. And some senators and representatives won't even like consider moving on a bill or like acting on an issue until they get like a certain level of response from constituents, certain number of calls, certain number of visits. So even if it's a low-level staffer, it does make a difference. And hopefully that you can push those other levels, like tweet about it after, make it public, send in those studies, maybe write something, write an op-ed. You talked about bringing up their ties to industry. There are lots of levers you can push. And yeah, this is one of them. And thank you for emphasizing the importance of personal stories. Kathleen, did you want to jump in?
Yes, thank you very much. I'm a retired physician, and I kind of like to look at the other side of it too, our side, and how difficult it is to manage a patient who's uninsured or inadequate insurance. And you end up compromising your recommendation based on the financial realities that patient has. So it makes it very difficult to practice. And the other issue is, I'm an ear, nose, and throat specialist. And for a while, I was the only one who would see Medi-Cal, I'm in California, Medi-Cal patients in 3 counties, because a lot of physicians will not accept that insurance and they won't accept Obamacare. So you're giving people healthcare cards, but without access to healthcare. And I think that goes unappreciated by a lot of the population, that an insurance card does not mean healthcare. And it certainly does not necessarily mean affordable healthcare. Thank you.
Thank you, Kathleen. That's a great point. And I think I should actually add that to my slides to make it clear that it's not just like the patients who have these stories. Some of the best lobby visits I've been in were healthcare providers, nurses, doctors, talking about like they've seen so many stories, right? And they see it kind of like systematically. And as you said, it often just compromises the care they can give. Often they're not making healthcare decisions based on healthcare needs. They're making it based on, the profit needs above them, and no provider should be put in that position. No patient should be. So yeah, that's a great point. I'm going to add that to the slide. So thank you, Kathleen, for bringing that up. I know there are questions in the chat, which I can look through too, but did anybody else want to hop on video and ask any more questions or practice any? I see a hand. Evelyn.
I'd like to piggyback on what Kathleen said. I'm a CPO, so I provide prosthetic legs and custom bracing to my patients. And I see it all the time. I'm in Ohio, so I see a lot of Medicaid patients where a lot of our orthopedic providers do not. And Medicaid doesn't provide the same coverage for technologies that Medicare does. So a lot of times I have to wait for my patients to be considered permanently disabled for them to, actually receive the proper care that I think they should have. And also, just this year, come January, a lot of legs I had in process, people's insurance changed over. So then I had to delay care to get the authorization for their prosthesis again, which Medicare for All would eliminate, because we wouldn't have to worry about these gaps in insurance coverage and the change of insurance coverage, which then I had to read a whole new policy to see what kind of prosthesis I can provide my patients. So that's it.
Thank you so much for that, Evelyn. And yeah, there's so many stories coming out of the disability community where they can't even like earn, if they earn too much money, then they're no longer considered, getting their supports or being disabled or unemployed. And that kind of ties into people doing that kind of work. So thank you so much for doing that work. That's amazing. And yeah, those are great stories coming out of there. Tim, did you want to? Nice Zoom background, by the way, Tim.
Yeah. What you did not talk about when you were talking about the current system was the waste and inefficiency of it. And I think that people, men, somebody brought up the point that women were more open to personal stories, healthcare stories, whereas men were kind of resistant to that. But the economic argument works with men. I'm also in a red district, and I do have a story, but it's my brother's, and it sort of covers both. My brother was an architect. He worked for a large company, and he incidentally specialized in hospital design. But he he and a co-worker decided they were going to go out on their own, start their own business. And the only reason that this was pre-ACA, the only reason that he didn't do it was because his wife got breast cancer. She had a pre-existing condition, and it would have been economically impossible for him, to buy insurance just doing a startup. And so it is detrimental to entrepreneurship. And that kind of argument, I think, might work effectively with men who would perhaps not be open to the more sort of personal medical stories. So I'll leave it at that.
So thank you, Tim. I agree with the folks in the chat in that we certainly don't base our strategy, on the gender of the person we're going to be talking to. I think the arguments you raised should work for everybody, and it's a good thing you raised that, because sometimes people ask me, well, they'll say like, I do have good insurance, so do I even have a story to tell? And you do, because like you can talk to the point of having insurance allows you to be an entrepreneur or make life decisions that you couldn't make otherwise. It allows you to do things with your children, your family you couldn't do otherwise. So even if you think you're stable with your healthcare and your health insurance, that's a story you can tell. And people who have those stories that Tim raised are particularly important. I see we're like under a minute left, so I do have to wrap up. But people, everyone will get these slides if you want them in an email after. And I put my email in the chat if you want to reach out to me. And I'll just point out that, telling these stories are so important because, when you're telling healthcare stories, you're really like fighting for your right to exist in this world, just to like be alive. So they really are truly very powerful, I think more so than in any other activist realm. So I hope you feel emboldened that like, you can do that yourself. And you all just did a really great job of it right now. So I'm very confident that you can. So thank you all. And I will read through the chat while you're hopping off, but thanks for coming.